Hi, happy National Dance Day. I'm Chelsea Kemlage. I'm a physical therapist at the OrthoVirginia Springfield location. I'm here to talk to you about the most common dance injuries. There are two categories that we're going to talk about today, acute and overuse. The first acute injury we're going to talk about are ankle sprains. Ankle sprains are happen when your foot is pointed and turned inwards, and it causes overstretching or tearing of the ligaments on the outside of the ankle. This usually comes with bruising, swelling, and pain on the outside of the ankle. Next, we have patellar dislocations. This is when the kneecap slides out of place, usually to the lateral aspect of the knee or the outside of the knee, because the foot is planted and the knee collapses inward. Dancers are also at risk for torn muscle and tendons. These usually are throughout the lower extremity, and they happen in various locations. Bruising and pain over that muscle usually occur when you tear a muscle. Next, we're going to talk about overuse injuries. Overuse injuries happen in dancers because of their long practices, their rigorous schedules, and oftentimes because of their altered nutrition. The first overuse injury we're going to talk about is patellofemoral syndrome. Patellofemoral syndrome happens with pain in the front of the knee, and the kneecap is usually not tracking properly because of a muscle imbalance with underuse of our glutes and overuse of our quads. Next, we're going to talk about a couple of different hip pathologies. One is called snapping hip syndrome. Snapping hip syndrome can be felt with a little click over the front of our hip, and it happens when a tendon snaps over the front of the hip. This is usually because of the overuse of our hip flexor. Next, we have impingement syndrome. Impingement of the hip, or FAI, can happen when there's too much stress and compression through the acetabulum and through the femur, or the ball and socket. What happens is there's extra bony growth in the joints, and that catches and clicks in the front of the hip. That can often be felt in the front of the hip and the groin. Dancers are, of course, also known for their foot and ankle injuries. A common one in dancers is called os trigonum. Os trigonum happens because of the repetitive pointing of the dancer's foot, and it usually causes an extra bony prominence to occur, catching tissue in the back of the foot. Dancers will know they have this if they have pain with pointing, and the pain will be located in the back of the ankle. Next, we have stress fractures. Stress fractures happen often because of the hard floor that dancers are on, and again, due to altered nutrition. When stress fractures occur, they're point tender right over that bone and are usually most painful in a weight-bearing situation. The last one we're going to talk about is a spondylolisthesis. This is when dancers spend a lot of time in extension, and they extend through their lower back so repetitively that it fractures the lumbar spine. These are small fractures that cause one bone to slip forward on another. This causes pain with long duration standing, extension tacks are bending backwards, as well as numbness and tingling into the legs. I hope that you guys are able to get out and dance today and enjoy your National Dance Day. Just know that we are here for you at OrthoVirginia, and if you feel like you need to talk to a practitioner, please contact us. We are at orthovirginia.com, and we're always here for you. Thank you.